Gaza's unique in a few ways. The most obvious way is just the number of children that are injured. Now, obviously, Gaza it's a half child population. Half of the people in Gaza are under 18, but nevertheless, the injuries to children are widespread, and it's extremely difficult to deal with them. That's one major way. The second way Pardon me. The second way is that the healthcare system itself is just under direct attack. And like I said, there's no close parallel to that in history that I can think of. Every hospital in Gaza has been attacked. Every hospital in Gaza has been forcibly emptied. Every hospital in Gaza is starved of supplies. Something like 5% of the healthcare workforce has been killed, maybe more than that. It's hard to know exact numbers. The largest hospital in most third world countries have one large hospital that provides all of the advanced, the really first world level healthcare. In Gaza, that was Shifa Hospital, which basically doesn't exist anymore. It's now basically, it used to be a 750 bed medical complex. So like it would have been the seventh biggest hospital in the state of California. It was a huge place. It had all sorts of advanced modalities of care, all sorts of international subspecialists walking around. It's just rubble now. There's a small emergency room that's functioning, and I think there's one operating room that they set up in a dentist's office. So, it just basically doesn't exist anymore, which means the biggest hospital now is Nasser. And Nasser is now basically the only functional hospital of any significance in the Gaza Strip, as far as I can tell. These things change day to day, unfortunately. But European hospital, where I was last year, is now an Israeli troop barracks. They're digging up the entire place, trying to find some tunnel that they can claim was under the hospital. Okay. So yes, that's another way. A third way is that the entire population is seriously malnourished, which makes surgery pretty difficult. I can cut anybody open, but if their body has no protein, if they don't have any access to nutrition, then it makes it very hard for them to heal anything. Fourthly, Gaza's entire population is homeless, like virtually all of it. Not only homeless, but displaced, and often displaced 10, 15, 20 times. So again, when you combine a child population that was half refugees, or actually more than half refugees, about 70% refugees before October 7th, all of them are now homeless and displaced. All of them are hungry to the point that people are actually dying of starvation. And it's also one of the most wounded populations in the world, with one of the most degraded healthcare systems in the world. You can
Right.
see how it's a unique place.